Well, thank you, Mr. Chairman, for holding this important hearing in South Dakota and allowing us to gather information from those who are affected most by the Indian Health Services, and those are our tribal communities. I want to thank Chairman Barrasso has been terrific on these issues, and as he mentioned, we had a hearing back in February. This is a follow-up hearing to that, but most importantly occurring here in South Dakota, where we can hear directly from people who are impacted. And it's nice having someone like Senator Barrasso chairing the Indian Affairs Committee. He's a neighbor from Wyoming, so he understands our issues. He's also, as he said, a physician, an orthopedic surgeon. So those of us in our 50s who are always looking for medical advice in the Senate turn to him quite often. He doesn't do surgeries.
Free advice.
Yeah, that's right. Yeah, that's the best kind of health care. He doesn't do surgeries in the cloakroom, and a lot of times it's go take 2 aspirin. But anyway, it's great having somebody with his background and expertise addressing issues that relate to health care. The reason that we're doing this, and we held what I think was a very necessary oversight hearing back in February regarding the chronic failures of the IHS, failures that frankly are just unacceptable. And we heard some pretty stunning stories, and at that time I think you, Mr. Chairman, heard the same stories that Senator Rounds, who participated in that hearing along with us, heard. And you continue that oversight into an agency that seemingly just doesn't have accountability to anyone. CMS's findings, as terrible and horrific as they were, brought forth evidence of reprehensible practices that were occurring at the Indian Health Service. Practices that did not match, I might add, information that was provided to members of Congress, including myself. CMS's findings have once again provided the public window into these facilities to view the substandard care that's being delivered to our state's tribal citizens. Stories have been detailed time and again, and it is time to take action. After these reports were released and the hearing in February was concluded, Chairman Barrasso and I, as he mentioned, immediately began to explore ways to reform the agency. The result of our efforts, combined with tribal input, culminated with the introduction of the IHS Accountability Act of 2016, which attempts to tackle this crisis from all sides. And Senator Rounds has been very active in that process and is also a co-sponsor of the legislation. The legislation which we are here to discuss today increases accountability, improves hiring practices, enhances recruitment and retention, protects whistleblowers, increases fiscal accountability, and creates greater transparency at the agency. In an effort to improve accountability, the legislation provides the Secretary of Health and Human Services with the streamlined ability to remove underperforming managers and executives. As I've said many times, leadership starts at the top. And if IHS leaders are a barrier to delivering quality care, then they should look for another job, not simply be moved to a different area. While we need strong leadership, it is also no secret that providing care in remote rural locations is difficult, which is why we have included provisions to streamline hiring and to incentivize the recruitment of providers. One of the largest barriers to change currently plaguing IHS is the lack of transparency. Unfortunately, IHS is simply unable to answer straightforward questions regarding funding allocations and outlays. For example, the agency estimates that it spends $50 million a year in the Great Plains area on temporary, non-full-time staff. What the agency does not know is whether that number is accurate and how much it would save IHS if they were able to achieve permanent staffing of full-time employees. What's even more troubling is the question of where the agency is taking this funding from in order to paper over this problem. This brings me to our bill's next point: fiscal transparency in long-term planning. Our legislation requires IHS to issue spending reports to tribes and to Congress, and requires the agency to release a staffing plan. The creation of a spending plan is essential to understand exactly how IHS allocates funding not only nationally but within each area. Lastly, and most importantly, we wanted to ensure increased tribal consultation when IHS hires senior staff. One of the major complaints that we hear constantly from our tribes is the lack of meaningful consultation. I hope to continue discussions regarding what meaningful consultation means to our tribal members and what we can do to improve it. And while there's no doubt that more oversight is necessary and will be conducted. Today's hearing allows us the opportunity to explore changes to this failing agency. It provides us with a chance, with input from our tribes, to change the status quo. I would like to acknowledge and thank the administration's willingness to work with us, to engage with us on these issues, and look forward to continued collaboration. And I also want to thank particularly our tribal leaders, tribal representatives, and individuals who reached out to me with their concerns and solutions for IHS. Your continued input and suggestions are still needed, and I am committed, along with the delegation, Senator Rounds and Congresswoman Noem and others who want to take on this battle with us, to working with you to bring forth positive solutions. So thank you, Mr. Chairman, for being here in South Dakota. Thank you for bringing the Indian Affairs Committee to this state and to giving intense focus to an issue, and frankly to something that has reached, I think, a crisis stage and desperately demands a solution. Thank you.